Anemia is one of the most common age-related health conditions, thus it is of special interest to healthcare practitioners. Anemia is said to be frequent, benign, and a normal part of the aging process. This is a misconception. Anemia is neither harmless nor normal. Anemia in the elderly has been shown to be associated with increased mortality, increased risk for falls, poor physical performance, and reduced muscle strength. Lack of communication and coordination of care in this population will result in medical errors, testing and treatment duplicate, misdiagnosis, leading to frustration and negative care outcomes. The key to combating anemia in the elderly is diagnosis, monitoring of hemoglobin in a timely, efficient manner, and implementing a computerized decision support program for treatment of anemia in the elderly, with the goal of optimizing anemia management. However, majority of medical organizations and providers have been slow to adopt health information technology. An existing hemoglobin test in most rehabilitation centers and hospitals demand invasive blood draws and long wait time in obtaining the result. Non-invasive hemoglobin screening do not require blood draws or blood sample. Instead, it provides real-time measurement of hemoglobin concentration using multi-wave non-invasive hemoglobin sensors. The capability of smartphones has extended beyond simply making calls, sending messages, or surfing the web. Add-ons and apps has transformed this small electronic device into a powerful medical device, which has revolutionized the way some illnesses are diagnosed and treated. The most recent hemoglobin innovation, the most recent technological innovation, the Yemi app, is designed to detect hemoglobin concentration with the use of smartphone camera and some extra lighting, which eliminates the use of needles and expensive specialized machines. Yemi app estimates hemoglobin concentrations and other blood components like plasma by analyzing how the color of blood are absorbed and reflected across wavelengths, using the light from the phone's camera with additional help from external lighting. The ability to screen for anemia in the elderly quickly using a smartphone-based test could be an enormous improvement in patient outcomes in this population.
App is a novel application that uses a smartphone camera to measure hemoglobin concentration in your blood. Hemoglobin, which is what gives blood its reddish color, is responsible for carrying oxygen around the body. If you have too little hemoglobin, your body can't deliver oxygen efficiently. Hemoglobin measurement through a blood test is widely used to screen for childhood malnutrition, a significant problem in developing countries. However, there are concerns about cleanliness with blood tests, especially in rural areas. In light of these concerns, we looked for a solution that non-invasively measured hemoglobin without the worry of handling blood, yet cheap enough for developing world. Hemoapp takes advantage of the absorption properties of the blood at different wavelengths of light. The blood consists of about half water and half red blood cells. Depending on the amount of red blood cells that are present, the color of the blood changes. Using a phone's camera, this change in blood color is captured. The biggest challenge is we try to explore different lighting options depending on the resources a user may have available. It's conceivable that we can incorporate all the lights into a phone case, but we also found that infrared spectrum of an incandescent light was a good alternative to a custom case. By measuring the absorption of the blood under different wavelengths, a machine learning algorithm based on data from a clinical study can determine the hemoglobin in the blood, all without ever having to draw blood. In the same clinical study, we compared our results to an FDA-approved non-invasive hemoglobin measurement system and found that our system performance was comparable. The biggest difference
The ability to measure hemoglobin levels instantaneously and non-invasively offers important clinical value in the assessment of the elderly anemic patients. Non-invasive hemoglobin measuring technology is a rapid, portable, and accurate way of providing identification of blood loss or anemia without the need for intravenous access. Additionally, with this technology, hemoglobin can be continuously measured in patients with active bleeding to guide the start and stop of blood transfusion and to detect occult bleeding. Technology advancement implementation of computer-assisted devices improves the efficacy, cost-effectiveness, quality, and safety of healthcare delivery. Non-invasive hemoglobin screening are increasingly used during surgery, by obstetric and pediatric practices, in intensive care units, and during invasive procedures that carry a high risk of bleeding, subsequently reducing healthcare costs, caregiver burden, and improved patient family caregiver satisfaction. However, the full potential of using non-invasive hemoglobin screening for diagnosis of anemia in the elderly population is not fully realized. The swift and non-invasive measurement of hemoglobin and availability of continuous hemoglobin data will be extremely useful in this patient population in a variety of situations, which includes on admission and when making triage priorities. It is promising technology that has the ability to enhance the process of care and patient outcomes in the elderly.